Okay, so we're starting. Good afternoon, everyone, and welcome if you're tuning in now from online. My name is Carlo Martuscelli. I'm a health policy reporter with Politico. And I'm about to interview none other than the Health Commissioner herself, Stella Kyriakides. Thanks a lot for joining us today, Commissioner. Before we start, just a few housekeeping remarks. You can ask questions through the Swap Card platform, although I seem to be missing the tablet. If you're in the room, you can scan the QR code on the screens. Otherwise, check the instructions on the event website. We like debate, so please do talk about us on X, previously known as Twitter, or the social media platform of your choice. Our hashtag is Political Healthcare. Commissioner, we're approaching the end of your mandate. It's been the most significant one ever for a health commissioner. We've had the pandemic, an unprecedented expansion of the EU for Health budget, the cancer plan, the health union, the Pharma Package. Yesterday, we had a communication on medicine shortages, and I could go on and on. My question to you is this. Do you think that we've reached the limit of what the Commission can do within its current legal framework? In other words, in the next Commission, should we think about opening up that Pandora's box that is treaty change, or can we still keep going for some way, just using the tools we have already?
First of all, let me say what a pleasure it is to be here, and thank you for this opportunity. That's a question that I could possibly answer with two words, whether we've reached our limit, and I would just say definitely not. But I want to explain why I say that. You're absolutely right that we have faced an unprecedented public health crisis, which was the COVID-19 pandemic, and several other crises after that. And in the area of health, as you said, that health is a member state's competence. Okay. Sorry, do I start from?
No, it's okay. I think you could still be heard.
Okay. Health being a member state's competence, we managed to put together, with what we have learned from the pandemic, what I believe, and I strongly believe in this, the foundations of a strong European health union. And you mentioned some of the aspects of the European Health Union. A much strengthened EU for Health program, Europe's Beating Cancer plan, the first time we have a comprehensive strategy on mental health, the European Health Data Space, the pharmaceutical reform. There are 7 pillars. We have put the foundations. We are seeing already actions moving on this. But I think that, and I believe that there is a lot that can be taken forward. And in terms of the treaty, when we started speaking of the European Health Union in 2020, there was a great deal of buzz in the sidelines of how can you speak about that? Do we need to change the treaty? And I felt from then on that we have seen with the pandemic how much we can do within the current treaty, with collaboration, solidarity, and working at the European level. So I felt that if we got into this long discussion of changing the treaty, we would delay in health. And in fact, that is what the European Health Union is about. Within the treaty and respecting the treaty, what we can do at European level to make prevention and treatment and access for citizens in the area of health to have equity. So that's where we are, I believe, in going forward. And there's a lot that I'm sure that the next Commission will be picking up.
Okay, great. I definitely want to return to this idea of laying the foundations for the health union a little bit later. But before I do that, I did want to ask, again, looking ahead at the next Commission, it's clear that health has become at the European level a topic of very considerable importance, and it's spanned many areas that maybe at the start of this Commission we wouldn't have naturally assumed it would touch on. I'm thinking of industry, technology, data, the creation of Hera in some ways really captures this. So I was wondering whether you think in the next commission, whether the position of health commissioner should get a kind of level up. Maybe we should start considering a vice president role for health, for example. Or do you feel like you're not really, it hasn't been a limitation for you?
I honestly have never felt it's been a limitation. I think the way we see health and what you have said, that it needs to be comprehensive, it needs to be horizontal, it needs to be across all policies. It's part of life. We have seen with the pandemic that we need to look at the health dimension, whether we're looking at the environment, at climate change, at the use of digitalization and AI. This is part of what we need to do when we're looking at health. Give an example, Europe's Beating Cancer Plan. Yes, health, but we're working 13 commissioners because other aspects come into it, from skills and employment to industry. So if you look at health in that horizontal way, it isn't for myself so much whether you have in the commission a vice president role or not. It's what you, in your political role as a commissioner, together with your colleagues and the president, believe when you're dealing with health. And yes, there's a paradigm shift in health, and it has been shot, I think, to the top of the political agenda, and I sincerely hope that it remains there in the positive way, not because of a crisis, so that we'll continue to build.
On this point of where health is on the political agenda, in some ways it's natural. Of course, coming out of COVID-19, it slips a bit, especially because we've had a succession of other crises in Ukraine and now the Middle East. Health is a little less prominent to the general public, and that's understandable. At the same time, at the technical level, at the policy level, there's been a lot of work going on, but we know that any policy requires political backing and a political push behind it to be effective. Do you feel like there is that political backing for health still? And is this something that's going to continue in the next commission, or do we risk health slipping down, and with that momentum we've built up until now?
I definitely feel that there's that political backing. I also think that that is partly attributed to the fact that we have now the foundations of a strong European health union. That is no longer a vision, it's not abstract, and so we work towards it. Despite other crises, we're working constantly to implement what we have started to put together. And I'm confident that this will be picked up and carried forward by the next commission.
Is there any additional elements of the health union we should expect to fall into place, whether legislative or non-legislative, between now and the end of this commission?
We've changed the, as you may know, the mandate of the European Medicines Agency and the European Centre of Disease Prevention and Control. Those were two central pillars because we saw with the pandemic that we managed to do a great deal, but these need to have structural reforms. We have the comprehensive strategy of mental health, Europe's Beating Cancer Plan, huge European initiative, 4 billion euro for the first time budget for cancer. That is constantly unrolling. We have 30 joint actions just for this year, and this will go on into 2024 and onwards. Pharmaceutical reform, that is now going to be discussed, has to start in the Parliament and the Council. I would hope that the European health data space discussions for the European Parliament and Council will move in our mandate, because digitalization in health is important. So there's a great deal that is still developing, but in terms of legislative work, I think it would be the European health data space and what we have now in terms of tissues and cells, hopefully by the end of this year.
I wanted to talk about the cancer plan, which you just mentioned now quickly. before the pandemic, it seems like the cancer plan was going to be the really big ticket item of this commission, and it still is a really big item. Obviously, the pandemic came and we had a lot of change. How is the cancer plan going in its implementation phase? Because I've heard there's been some difficulties getting funding out the door, especially with NGOs and countries having to absorb some of that funding, the way it's structured. Countries also need to put in some money in the pot to have it matched. So are we seeing any difficulties in absorbing and implementing the plan?
Well, there's huge challenges. It's a massive endeavor, and we need also to be pragmatic with the cancer plan. But I'm very personally committed to it. I'm myself having had cancer. And President von der Leyen has really been so supportive, and it's her personal commitment from the beginning to support this plan. What I can tell you is that despite and in spite of the pandemic, the team working on cancer within the European Commission, our team dedicated to that, at no point stopped the implementation part. So because of the pandemic and everything else that was going on, we have been pressing forward. And I believe that we are seeing changes. We've upgraded the cancer recommendations for 3 types of cancer after 19 years. 19 years, the world has changed in medicine, and it took us 19 years to make a difference and upgrade our screening recommendations. There's a lot that is coming forward now. There are challenges. For example, we have a goal that by 2025, every member state needs to have at least one comprehensive cancer center, because equity and the patient needs to be at the center of the plan. That's a challenge. But I'm traveling with the team, and we're going from member state to member state, visiting their oncology centers, not in order to just see the weaknesses, but then see where we need to direct the funding.
Sure.
And for the first time, Carlos, in this February, we issued a cancer inequality register. Why? Because unless you know the weaknesses in the member states, where they have the weaknesses in screening or prevention or treatment or aftercare, you don't know where you should be directing your support and your funding. And this is what we're doing. So it's not about a plan. There's a very clear implementation roadmap, publicly available to have transparency. And I'm very confident that this plan is delivering.
Just to press you on this point for a second, but what about the NGOs and the civil society groups? I know they're part of some of the actions in the plan. A lot of EU for Health funding is going their way. Are you finding the work on the cancer plan that you're doing with them easy? Are there any difficulties there?
And the NGOs and those who are working in the field for cancer, as with any issue in the area of health, they have a clear role that can't only be supportive, but they also need to be advocates, and they also need to be pressure groups, and I fully respect that. My position has been from day one that everybody, in all the strategies, the policies we put forward, that needs to have a seat at the table where decisions about them are made. We cannot talk about them. They need to have a seat there. So I've been working very closely with them from day one, and it's for them to say, not for myself, but I hope that we have built a constructive relationship so that this plan can really make a difference for all Europeans going forward.
Just before moving on, I just wanted to ask you one more question related to the plan. I know that the tobacco taxation rules, which are one of the actions listed in the plan, they were meant to come out at the end of last year, and they haven't come out yet. So I was wondering where we were with the tobacco taxation rules, and also, if I could just add to that, alcohol labeling as well, because I believe that was also a action that was planned this year, although we still have some time with that, I guess.
Yes, both are in the process of we're studying them for for the tobacco legislation. This needs to be, I think, then we need to see an overhaul of this, and we're assessing now exactly what changes. A lot has changed in the area. Tobacco is one of the key risk factors. And this is why we're coming in 2024 with a new recommendation for tobacco-free environments for the second-hand smoke. And as with alcohol labeling, we're working on this at the moment. So this is also part of a big prevention package that I hope will be able to be ready by the early 2024.
Okay, great. So these could possibly be bundled or at least released?
We'll see what is actually ready. I think in terms of tobacco-free environments, we will have something ready. In terms of preventive cancers like the cervical cancer and vaccination, we're going to come forward with something early 2024. We're working on this at the same time.
Okay, great. I wanted to go back to looking ahead again. Earlier today I spoke with the Belgian Health Minister Frank van den Broeke, and one of the issues he mentioned that he wanted to tackle during the upcoming Belgian presidency was this issue of the health workforce, where we're seeing these staff shortages in many European countries. He mentioned he saw a role for the EU there. I wanted to know if you also thought this was something that either your commission or the next one should be working on, because while it is an individual country problem, it really seems to be transversal and shared by most EU countries.
Yes. I've managed to very briefly speak with the Belgian health minister on this. I know that the Belgian presidency will be looking at it. It is a real issue in many member states that we're seeing, but we also need to understand why and what we need to do about it. So I think that it will be something that we'll be picking up and the next commission, and you need to understand the reasons and in order to be able to direct the actions. So I'm looking forward to working with the Belgian presidency to have a bigger overview of this in all the member states.
Great. I mentioned staff shortages, but I was curious to get your views on what you thought are the next big issues in terms of health. I mean, it seems like there's so many to choose from climate change, bio threats, future pandemics, but what do you think the next commission should be working on when it comes to health? And if you want to relate that to the health union as well, whose foundations you said are now laid.
I believe that this commission and the next commission needs to go on working into building and establishing the strong European health union, one that is built on collaboration and solidarity, and one that puts the citizens in the center in the area of health. I remember so vividly in the first months of the pandemic, which was just after we had come into our positions, hearing so many citizens saying, where is the EU in the area of health? And I do not want anyone to have to hear that again. We are there, we can do things at the European level, and that's what I would like to see moving forward. And also a European health union based on equity. And I'm going to take the opportunity,
please,
because you touched on it, because we talked about shortage of staff, for example, shortage of medicines. I would like, in the future, 10 years from now, to be able to say that we did something that really dealt with the problem, and every citizen, no matter where they live in the EU, has access to the medicines they need when they need them. I find it unacceptable that in the years that we are now, citizens in member states, patients, don't have access to medicines they need when they need them. And this is why we put forward an ambitious reform, a communication yesterday. We're not going to solve things overnight, but I would like to be able to say that 10 years from now, we're in a much better situation for patients, and that we had something to do with it.
I wanted to pick up that point on equity in relation to pharmaceuticals, but not in relation to drug shortages, but rather the pharma package. One of the key planks of the package, or at least as it's been discussed, has been this issue of trying to equalize or at least level some of the inequalities we see in access to new medicines between member states. The Commission presented some shocking data showing that something like between the country that has the most access to new medicines and the least access, there's a 9-fold difference. It was something like
90% in
yes.
big member states and maybe the lowest as 8 to 10% in other member states.
It's one of the boldest proposals in the package, but it's also been one of the most criticized, especially by the pharmaceutical industry that takes issue with the adding of the data protection and the subtracting, the carrots and the sticks. What do you say to critics who basically say, you know, this is the Commission going into medicines reimbursement, albeit indirectly? You know, on the one hand, we have this big problem. On the other hand, reimbursement is a national competence. I mean, what's your response to them? Because this has really been one of the key issues of the debate so far.
My response as a health commissioner is that we need to ensure that each patient, no matter where they live in the EU, has access to affordable medicines, available, affordable, innovative medicines. Yes, it's an ambitious proposal. It comes after 20 years since the last overhaul of the legislation. Yes, I can understand that there are different points of view. It's going to be discussed in Parliament and in Council. But if we're going to make a difference, we need also to be ambitious. And I don't believe we're on opposite sides with industry. Mm-hmm. I believe that we need to strike a balance. We need to keep a strong, vibrant, innovative European pharmaceutical industry. That's important. But at the same time, not lose sight that innovation also needs to reach the patient.
Right.
And that we need to have equity. And you mentioned yourself, huge disparities. We need to deal with them. So I'm very much looking to taking this forward in the Parliament and in Council to make sure that we find the right balance.
I don't know if you can comment, but we've already seen some draft reports from the two rapporteurs. They'll need to be negotiated then in the Parliament. There's a ticking clock here, and I know there's been some criticism for the Commission for the delays, which leaves the Parliament not much time to at least land on a negotiating position. Regarding the timing, do you think we can do a deal before the end of this Commission, at least at the political level?
I would hope that the European Parliament places this as a priority and that we are able to move forward as quickly as possible. I think for myself, for ourselves, it is a priority and we're there and we're available. I'm not going to comment on what has come out, but that's what this is about. This is a process where we discuss and we find compromises in order to be able to bring about the changes that we want. But ultimately, we must not lose sight of why we're doing this. And we are doing this because in a European health union, you need to have citizens and patients at the center in the access to health services. And medicines are very critical to this.
A question on another, let's call it hypothetical piece of legislation, which is this Critical Medicines Act, which Belgium first put on the table. It's gotten, it seems like a really wide consensus among the capitals. It's mentioned briefly in the shortages communication. You set up this Critical Medicines Alliance. and you're setting up a study to look into this issue. In your personal opinion, do you think we need legislation here? Should we have a Critical Medicines Act?
We put forward a communication yesterday to address the shortages of medicine, because that's where the paper came out with this proposal from Belgium and other member states. For me to answer that, I would first need to be in a position to see what we put forward yesterday being rolled out. I am always try to be evidence-based in what we decide as policies. You mentioned we've put forward a Critical Medicines Alliance. That's the beginning, and that will allow us to now study, because to have a Critical Medicines Act legislation, you need to look at all the parameters. You need to look at industry, you need to look at trade. So we're going to start a study on this, and then if necessary, impact assessment, to be able to see exactly which is the way we go forward. But in the meantime, we cannot not address, that's too negative. We cannot.
We should address.
We should address, sorry. We should address shortages. And what we put forward yesterday, it comes to address shortages in the short term and the medium term. What we've done before in the pandemic, we are now putting forward in a more structured way, so that we're able to solve issues that we saw last year when we didn't have antibiotics and pediatric medicines in many member states. There are ways we can move before we have legislation, and that's our responsibility to put forward these proposals.
We're getting close to the end, but I had one more policy-related question, which is Hera. Should it be an agency or should it stay a DG? Do you have a view on this?
I have a view on Hera. Hera established as an authority 2 years ago. And within 2 years, it's shown its worth. And it's shown its value, and it's shown what was missing before we had Hera. By the end of next year, there's going to be a reevaluation, taking into account all the work done. And I think that's when decisions will be made in terms of whether we need to change some parts of its mandate to what we thought should have been and are 2 years ago, and whether it needs to become an agency. So we're at that point now when a year from now we'll need to make those decisions. But I have no doubt that Hera was very much needed, and I will never stop, I think if I'm allowed, praising my own DG Sante, Hera, and everyone else, because this is not about what I as a commissioner, if I have achieved anything, have achieved. This is a group of very dedicated people in my team, in my DG, in Hera, in the agencies, that all have the same belief. And we all believe in a European Health Union. And this, I think, comes out, I hope, in the work that we do over the last few years.
Commissioner, I started this job in March 2020, actually, when I landed in Brussels the day that it shut down due to the pandemic. And I remember those, couple years of very, very intense work the Commission was doing. And if I can also say, us at Politico were doing as well to keep up with you. I just wanted to know if you could take a stroll down memory lane for a second and say, what was for you the single craziest moment as commissioner in that time or after it, but I have a feeling it'll be in that time. And if there's any also highlights as well, a positive memory.
I think there were so many crazy moments. I came into my position 1st of December of 2019. And I remember on the 9th of January, I asked in my cabinet that we should have a COVID team. And I remember the expressions on their faces, thinking, this new health commissioner, she can't be totally there, because what's this thing of COVID? But something was telling me that something was going to go bigger than that we thought. There were very many difficult moments. But I don't know what the craziest moment was, but I know the best moment. And one of the most important moments was in December, that 26th December, when we had flights going to every country in the European Union delivering vaccines at the same time for every single citizen. And that's when I thought, if we can do it for COVID, we can do it for health. This access to everyone at the same time. I think that will, for me, be a precious moment.
It was a nice Christmas present.
It's something I believe showed the European solidarity and collaboration. But those first 6 months, I think, was challenging for everyone, as they were for ourselves.
I see that we're at time, but I did want to ask just one last thing. In a sentence, just a few words of advice for the next commissioner in the next term.
I don't know if I'm in a position to give advice, just to always have, and I'm sure that the next health commissioner would always be like that, to just be very centered in what we're trying to achieve. And 3 words, European Health Union. It goes across the board. What we've done and we're doing for cancer, we can do for rare diseases. So let's just stop being ambitious with health. Keep it at the top of the political agenda. This is more than 3 words. And move forward with this.
Commissioner, thank you so much for your time. Thank you. I want to thank the Commissioner both for her time and for coming here to Politico and for the fabulous work she's doing. It was such an interesting conversation, and I think the health union is one of those concepts that it can feel a bit nebulous at times because, you know, we still do have 27 separate health systems, but then as you approach it in different ways, whether you're looking at pharma or the cancer plan, or maybe in the future at this staffing problem, you start to kind of see it and to see how all these things connect. And exactly, it comes together. And I suspect that you know, next year and the year after that, the health union is going to be right at the top of what we're discussing. So thanks so much, Commissioner. And Joanna, our health editor, is now going to take the stage to make some closing remarks. So thank you.
Sorry about that.
Okay, so that's it. Politico's 8th Healthcare Summit is at an end. It feels like we could have continued for a week, but we've done a whistle-stop tour of all the key issues in health policy, I think, starting with the Pharma Package and finishing by this agreement that we need money and the political will to tackle the problems together, but also to ensure everybody gets the fair benefit of all the exciting advances and innovations that are also happening. So I'd like to finish by saying a huge thank you to all the speakers who have contributed to the event over the past couple of days. I'd like to thank Politico's star reporters, Helen Collis, Ashley Furlong and Carlo Martuscelli for all their work over the last couple of days. And I also need to thank our partners once again for making this summit possible. Our leading partners, AstraZeneca, FPA, Emergent, Pfizer and PPTA. Our presenting partners, Intuitive, Janssen, Novavax and STADA. And our visibility partner, the European Federation of Nurses. So for those of you who are with us on site, there's coffee available in the main networking room. Please help yourselves. We have more events coming up before the end of the year, respectively on biosimilars on November the 14th and mental health the first week of December. Do feel free to register on the Politico Live events website. And thank you to everyone who joined us here in the room and online. Have a good afternoon, and I'll see you next year.
This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.